Good afternoon, everybody. I hope you can hear me and see me. I'm not using any slides and I want to talk to you today directly. Thank you very much for joining us. As mentioned by Afifa, I also come from Kashmir. I was born and brought up there. And I did my medical school in Jammu. It's called SCOMS. While I was in medical school, I wanted to be a surgeon because that was my first clinical posting. But what happened in 2002 during my what we call as internship or foundation year in the UK training system is I had 10 days posting in psychiatry at Government Psychiatric Disease Hospital, Srinagar. For some reason, the hospital had been burned down just before I started there. There were only few wards standing and few makeshift rooms where patients were being seen. One of my then SPRs, Professor Ashid Hussain, who is a professor now, asked me to see a patient and do a mental state examination. And when I went to see that patient, he gave me a very interesting story that he's just come from Moon. He was at a wedding, and that was the time I got very, very curious about psychiatry. And within 10 days, I actually changed my mind from being a surgeon to a psychiatrist. Although I did do a house job in surgery later on before joining psychiatry formally in 2003. As most of you know, in India, getting any postgraduate degree, one has to sit a common entrance exam, and thousands of doctors take the exam after their MBBS. During those days, there was only one placement for psychiatry in the whole state in the hospital. So one had to score very high to get to the position. Luckily, I made it to top 10. I think I was 6th on the list. And I remember when I went to the counseling for the said seat, and when I asked them I want psychiatry, all the panel members, they put down their pens saying, why do you want to do psychiatry when you can do anything else? And I remember when I came out from the room, and all the doctors who had come for the counseling on the day were actually looking at me in a strange way. That what's probably wrong with this man? Why does he want to do psychiatry when he can do probably surgery or radiology or something else more fancy? I think that was a stigma at the time, but I think there were also inspirations, few of the people. I remember when I told my parents that I want to be a psychiatrist, they went quiet for a bit, but then they said, well, you know best for yourself, and we will support you as you want to do it. And I also remember during the same time, I think there were people who wanted to do psychiatry, and the in-laws or their fiancés would threat that if they do it, they will break the relationship, and it wouldn't work. So I did then finally started my psychiatry training in 2004, which in India is MD Psychiatry as IMHANS here. And I completed the training in 2007. And after that, I did work in Kashmir for a bit longer in National Mental Health Program before moving to UK in 2009, 2010. At the time, the Royal College of Psychiatrists used to run a program called IMHANS Equivalence, and I did apply for it. And I think the response I got after probably 6 to 8 months saying that I couldn't prove that my degree was equal to IMHANS Psych, citing various reasons. And reflecting that back on that, that's why I wanted to talk about better training in different settings. Was obviously working in UK now and working as consultant and as a teacher and a trainer. I know the know-how, what's happening, how we do work-based assessments, how we have kind of extracurricular activities, SSMs, other programs. That's not the case in most places. So back home, it was again, you do 3 years training. You see lots of patients, lots of clinical exposure. You work with very supportive people who are very, very busy. At the time, we were only few consultants in the hospital, few SPRs, I think 6 trainees or MD students. and we would see probably 100, 200 patients a day, which sounds probably ludicrous when we talk in context of UK, but it was. In a small room, you'll be whispering in the patient's ear, and on the sheet, you will just write F20, F19, F25, rather than the full diagnosis, which also used to help with stigma, because at times people would say they rather not have the diagnosis on the paper, and they would like the something which their family or friends can't identify with. So I couldn't actually prove that I had actually trained as a psychiatrist, and I could take a history or do a mental state examination at the time. And there's also another interesting story I want to share is to apply for MRC Psych, I had to actually give the curriculum and syllabus which I had studied and passed an university exam in India, but I couldn't find one anywhere. And then I sent my friend to Medical Council of India in New Delhi. He went in person, and they asked him for some fee, which he paid. And then to my surprise, I have kept the documents still. They had actually photocopied some syllabi from textbook psychiatry and stamped it as Medical Council, saying this is what we do. That doesn't mean that trainees who train in India don't train well. They do really work very hard, and I think at times harder than the trainees we do have. You have to actually answer long answer questions, which are harder to answer if you don't have studied everything, rather than multiple choice question. There's also a long case, short case, and rather than multiple kind of cases as in CASC exam here, which becomes tricky. And I think that there is strong hierarchy in there where things are meant, and you have to behave, you have to respect your seniors. It's not as easygoing as we do it here, but at the same time, I think the resources are limited. I think from access to journals, to online resources, to the libraries and other things is quite different and challenging, which I hope will change in the future. I think things are quite static. But looking back at the same department now, I think I'm glad that after I joined on 5th, 6th rank, I know in next year as trainee psychiatrist, my friend, he was second in the list, he joined as a psychiatrist. And after that, there was a culture shift, and many people in the top ranks started joining psychiatry. And gladly, I think up until a few years ago, there was no female psychiatrist in the whole Jammu and Kashmir, but now there are almost like 20, 30 female psychiatrists. And I hear all the new psych trainees at the moment, there around 21 of them are females. And there are a few female psychiatrists as well in the hospital. And I remember my then guide and supervisor, Dr. Professor Mushtaq Magoo, who used to sort of say or do couplet often when we were low or in despair that things are getting bad. मैं अकेला ही चला था जाने बेमंजिल मगर लोग आते गए कारवां बनता गया, which I can translate simply is that I was walking towards my destiny on my own, and then people came, and we became big group as it goes. I don't have much time, so I want to come back to UK now. So after I was put down for MRC Psych, I basically joined psych training. Although it was very easy. I think I had experience. I had a degree, I had a publication, so it was easy. I joined at Morsley and kind of went